My patients have aged along with me, and I've tried to help them, but honestly, they've taught me a lot about growing into adulthood themselves. I learned so much by listening. We are at Family Care Health Centers at the Forest Park Southeast location in St. Louis, Missouri. My name is Dr. Heidi Miller. I'm a primary care doctor, and I also serve as the Chief Medical Officer for the Missouri Department of Health and Senior Services. I love science, and I love interacting with people in a collaborative, productive, positive way. Medicine enables me to do that. I have practiced primary care in this center for 21 years, and our community health center is a federally qualified health center. We take care of everyone, regardless of their ability to pay, at every stage of life, babies to the elderly. I take care of adults and adolescents. Some of those patients have been with me for a couple of decades. In primary care and preventive care, we need to have a continuous relationship with patients. We need to make them comfortable. It takes many visits and sometimes years for patients to trust us. Vaccines are an integral part of preventive care, primary care, holistic care. It is one piece of what we do in primary care to promote someone's health and to troubleshoot problems that they're having. Over the years, I have provided vaccinations and offered them in the same way that I've offered other preventive health screening and preventive lifestyle recommendations. And I've learned that it's really important to read the room, to be very attuned to what the patient wants and needs. I always start with leveling the field. And when I bring up the topic, I let them know that whether or not you choose to take a vaccine is a deeply personal choice. And whatever you decide to do, I respect and I will honor it. Sometimes if someone is not ready to have a vaccine, we can at least gently plant the seed and then make sure that we address the other really important issues that also have to be dealt with that day. If a patient is declining a vaccine, there is a logical reason that that person has decided to decline it, and I'm so interested to learn the reason. I have found that the most powerful way to engage a patient is through asking questions. We want to educate, we want to give information, and it's helpful to have information from multiple sources, and particularly trusted sources. So sometimes I will refer a patient to the popular media, an article that has medically accurate information about a vaccine. I have also learned that it is more important to preserve the relationship with the patient than to accomplish a goal and check a box that that vaccine went in the arm that day. What you really learn from your patients is about life, growing through the different seasons of life. I have my patients give me advice on how to live my life. It's important to realize that there's some bidirectional communication so that they are a little bit more receptive to my recommendations for them, especially if I'm taking recommendations from them.